Thank you very much. When I was a child, I was told the three things you do in public speaking is be concise, be sincere, and be seated. I think that was the perfect coda to end the conference. I think Mikhail's a magnificent man, that things that are going on are horrific, and I'm going to try in some way segue that from our first world problems into something we can all do. So let me try and dance for you a little bit, and I'm going to keep it light because we might just need that right now. I bring you greetings from Western Canada. This is the world attempt at the skinny dipping world record, maybe once Ukraine is back to part of the nations. This is the silly stuff we do because this is how we keep ourselves going. I do not like people who put too much information on slides, but my entire disclosure slide, my entire sense of purpose in this world is largely summarized here. In this George Bernard Shaw, true joy is being used for a purpose that you yourself see as mighty, not being a feverish, selfish clot of ailments and grievances, complaining the world does not devote itself to making you happy. Life's a splendid torch that you and I hold for a brief moment before passing it joyously, happily onto the next generation. Perhaps after a nude slide, that's a better segue into what we just talked about. But what I want to dive into now is how we keep ourselves engaged and how we perhaps deal with that last third of our career, because we spent the first third dealing on ourselves, the middle third, it's all like this, by the way. If I can get a laugh out of this audience after the last presentation, I will feel quite good about myself. The middle third about the team and the last third about the culture. And it's an awkward topic, but I'm going to dedicate a fair amount of the last third of my career to trying to promote the importance of culture and the importance of caring about culture. Because so many wars, so many conflicts of even small are not knowledge. They're not humanity because we're all humans. They're actually cultures fighting. In other words, I'm going to try and use this soapbox here to comfort the afflicted and to afflict the comfortable. And the point is, guys, sometimes we are the comfortable. And I would imagine you can feel that palpably as you think about your first world problems. As you sat there thinking, oh, enough dismembered limbs, for goodness sake, I've got to get on the ski hill. Let's go through some of this stuff. This is my title, Medical Culture, the secret syrup, because I'm a Canadian, of success or failure. And you know what? I'm married to a beautiful woman. I have tedious, exasperating children. And because I'm not independently wealthy, I work as a doctor. Rather than the sort of fig jammy director of this, director of that, I want to try and appeal to you as the 14-year-old boys and girls that we all were once upon a time. Whatever mission you are on, it's important to you, and it's important to have a sense of the how. Not just the why, not just the what. We are mission-seeking people. Missions in the literal sense, missions in the philosophical sense. And if you're feeling bummed out, disengaged, it might be that you haven't spent the time to think about the why. You love jumping in and out of helicopters. I get it. Your palmar is turned on by the suit. I get it. But why are we doing it? Does it feel meaningful, or are we just going through the motions? And that's not an answer, that's a question. And that question is a 20, 30-year career of thinking about. And then here's the second one. The difference between happy people and unhappy people is their level of gratitude. So everybody starts to talk like this, giving deep, sincere thanks. And I am no different. I'm immensely grateful to be given this podium, this chance. But I'm just as immensely grateful to get away and kibutz with friends and go back home with a renewed sense of, yeah, this is special people doing special stuff. We're no more special than anyone else. We're no more special than bus drivers. We're no more special than the people working at the grocery stores that we look after. We just have different interests, different foibles, different weirdness. And we've got to somehow negotiate that as we go through the world. And that's why culture matters, and that's why you shouldn't shrink in your chair and think, oh, we can't talk about culture because that's going to start sounding like the sort of nonsense that is out there in the news right now. But it matters because whatever your initiative is, whatever your thing is, it's going to run into culture. People won't follow through with your ideas, culture. You won't follow through with other people's ideas, culture. If you want to define it, it's actually super easy. This handsome-looking man is Gert Hofstadter, and there are these cultural indices. And you know what? They have been used to determine the likelihood of planes crashing. They have been used to try and work out toxic work environments. And they've even been used in a very multicultural country such as I live in to try and work out why the Americans having trouble fitting into the Canadian system, or the Canadian fitting into the American system, or the Middle Eastern trainee, or you name it. A very simple Scandinavian example, given the preponderance of you magnificent folks in the audience, was when the military deployed overseas and you had Brits, Americans, and Norwegians. They were struggling to get along because they had the same culture but different, especially a different sense of assertiveness. And they tried all sorts of clever strategies and 5 Ps and 6 Cs and 12 Qs. But in the end of the day, what they did was they said the Norwegians are in charge on Monday, the Brits are in charge on Tuesday. The Americans are in charge every bloody day, is my sense. But my point being, you can use these things for practical solutions. Don't see this as just words on a page. This is getting forward. This is Jungian psychology. Thinking is difficult. That's why most people judge. And so go on a journey. As I said in my first talk, it's more about your ability to work in a team than it is your capacious brain or your nimble hands. Now, we may have reached the point in the conference where everything has been said, but not everything has been said by everybody. So I don't know whether this slide has popped up at some point, and I don't know. There'll be some people in the audience thinking, that's clever, I haven't seen that before. And there'll be some people thinking, not that old shite again. But let's go through Ikigai for a second. If you are lucky, if you are grateful, if you have a sense of why, it probably sits somewhere here. You get to do something, be someone, and that's just as important, not just what you do, but who you are. What you love, what the world needs, what you can get paid for, and what you're good at. Purpose, autonomy, mastery. You know when you're just doing resuscitation thinking, why am I assaulting this poor man at the end of life? That's because all you've got is mastery. You don't have the purpose and the autonomy with it. And in fact, the most interesting thing about Ikigai is not the 4 big boxes, it's the spaces in between. It's the sense of, I love this, but really, is this what people need? More helicopters? Or I get paid, I'm just saying, I get paid for this, but is it what the world needs? Or am I just going through the emotions and filling my CV full of one-liners? And on and on. Spend some time with Ikigai. This might seem like a very Canadian slide, but don't worry, be content. Happiness is a bit much, isn't it, guys? It's going to Las Vegas, filling yourself full of drugs, and that's why those people get into so much trouble. For all of us, we know what contentedness is. It's going to Zurich, the weather's a bit crap, the airport's a bit crowded, but you finally see those mountains, you get together with friends. Go for contentedness, and this has been my watchword for my kids, for myself, for every job I've taken or not taken. It should be 60% good, 20% great, because that's what keeps you inspired at 2 o'clock in the morning. And you know what? It should be 20% crap. Why? Because if it isn't, you're not taking out the recycling. You're not doing your community service. You're putting it onto somebody else. And then the next thing is, how do we work in this system? Because I talked about the fact that we have prehistoric emotions, bureaucratic institutions, and godlike technology on my last talk. But I come from a place with lots of cash. But look at this, a clock in the emergency room. How long to see the emerge doc? 19 insert expletive hours. And then look down at the bottom of the slide. Administration, God bless them, has the gall to write right care, right place, right time. This is the existential stuff that we have to deal with, not do I know how to hold the ultrasound probe, am I a good ultrasonographer? It's actually just dealing with the slings and arrows of outrageous fortune. And so some of you have met my dear friend Matt Morgan. We write a lot for the BMJ, but this is a piece we were rather pleased with. ICU's most powerful tool is skilled staff. They need maintaining, they need nourishing. They need this weird combination of acknowledgement, because we're a bit needy, we're people pleasers. We need a bit of empowerment, because we don't do well. We can become a bit unruly if not empowered. we can be what my father referred to as people who stand on the outside of the tent pissing in rather than the inside of the tent pissing out. He was always good for a one-liner, was the old man. But here's the point. We talked about simulation. What follows every simulation? A debrief. I haven't had my COVID debrief yet. We went straight from the COVID crisis to the OR backlog. And you probably feel like that with the other stuff, just building time into your day to just reflect, to just be, to just let the world happen. And we don't as people, and by the way, I hope you can see, I'm pointing as much of this on us as I am on other people. We'll cram that day full. You know, the minute I finish rounds, there's a little bell in my head or on my phone saying, get to the office, go to a meeting, write a paper, do this, self-improvement, blah, blah, blah. As the wonderful speaker from before pointed out, there needs to be just time to be. And this is the issue. We work within this system. Now, this is why I stopped writing x-axis, y-axis empiric science and why I started doing this stuff. By the way, I'm a neurointensivist. I had to give a talk on the Glasgow Coma Score and the problems with it, because we're talking about 4 scores and different scoring systems for patients who are intubated or paralyzed. And so I typed into Google predictive search the problems with Glasgow, and this was the picture that popped up. My point being, I don't know what my point is. Here's another point, let's say that. We blame the other, right? It's a very early team-forming thing to slag off the others and to define the others. We here in intensive care, we know what's going on, those morons in surgery, those morons in admin. That's when you should know that your gratitude shrunk, your sense of meaning has shrunk. When you feel it expanding and expanding and expanding and saying, hey, we're all people trying to deal with a difficult thing, you're onto something. What I want to do is try and present this idea that we need a 12-step program. You'll recognize this from addictions. Now, I don't have the right phenotype to get hooked on booze. It just makes me feel rotten. Not as rotten as 4 pounds of melted cheese did last night, by the way, for those of you that went to the fondue. But, and I don't think I've got a sex addiction. I don't think I have this, that, and the other. But let's face facts. We probably have a prestige addiction. We need to be thought of as terribly important. We need to be involved. A lot of us won't retire simply because we don't want to be irrelevant. That's a big issue. That's an existential issue. You should face up to that. And it is exactly the same as addicts of substances. And having worked with a fair number, it's very interesting. They will actually say, thank God I hit rock bottom. And they'll point at people like me and say, you guys never do. You sort of bounce around near the top and you never sort yourself out. Now, feel free to disagree with me. It's the only way I learn. But I'm going to take a couple of those 12 steps, admit there's a problem, apologize. I hope that's coming across. I have definitely had cancer of the personality at times at work, and I am sorry. I've also been self-righteously right, but unable to express that in a way that advocates for my patient, and for that I apologize. Ask for help and serve others. And for the young people in the audience thinking, no, line my bank account. No, build my CV. No, beat the world. I promise you, you'll eventually come back to serve others. That's why you stood up and clapped, because this glorious man's been serving others. And for the military people in the audience, they'll know not only do officers eat last, but the reason they keep signing up again and again is because you want to be in a system where people help people who help people. And it goes around and around. Now, for those of you working in big urban centers right now, like I do, with a huge drug and alcohol problem and the knife and gun club every Friday night, and you think, and when people say you're lucky to have such an important job, and you think, I don't feel lucky, one of the things missing is that sense I'm helping people, that those other people aren't helping people. Again, that's where you have to dig deeper into the meaning. Now, I've gone too touchy-feely, too Dr. Phil, too Oprah Winfrey, so let me back up again. This is my dear old dad. He's a magnificent man. And if you don't like this talk, just read this paper. This is the first bedside test for ethylene glycol so that you don't have to wait until the lab wakes up. I don't know if your lab is solar-powered like mine is. The sun goes down, they don't work. But the point being, this is good old-fashioned science. And my dear old man is still working at 83, and he's convinced he's going to cure cancer. And you know what? I have argued, if you think there's a solution, you're part of the problem. But the point is, that's his jam. That's his purpose. That's his Ikigai. But this is dear old mum. This is mum driving me to medical school 30 years ago across Canada, lecturing me the entire way because finally somebody in the family was going to join a profession that she deeply honored. We paid her back by killing her. The poor lady died of Jakob Creutzfeldt, associated with blood transfusions in dear old Nottingham, England. Now, I realize that's hyperbole, but we're at the middle part in the talk where you have to grab people's attention back. But she was a palliative care counselor, and I wrote about the rotten end-of-life experience that we gave her. Because all we were offering were pills and potions, not hand-holding, not looking in the eye, not giving meaning, and not honoring that last part of life. There are 2 days in your life, less than 24 hours. The day you're born, we know what to do, we celebrate. The day you die, I think Matt Morgan pointed out that we don't always get it right. Mum used to say, and this is where she would disagree with Matt, you only need one life as long as you know how to live it. She knew how to live it. She taught me the importance of hatchings, matchings, and dispatchings. That's life, right? How we're born, how we union, and how we pass on. Union. I don't know, I just made that up. Mum was also a horrible plagiarist. Any idiot can face a crisis. It's the day-to-day living that wears you out. And that's why COVID was almost easy. That's why the crisis is almost easy. It's the 2 o'clock in the morning, is the patient here yet? That's not so easy. And this is why a dear old friend of mine just quit. He said, when I started this job, I had a bag for cash and a bag for crap. Both bags are now full. I'm out of here. Now, if you recognize that, you need to address that. Because there is a great resignation. There is quiet quitting, where people just sort of turn up but don't engage. And there's quiet firing, where people are just sort of ignored to death. This is my example. And it's a great book by David Brooks. You climb up a mountain. We're in the mountains. This will work. You climb up the mountain. It's all about external validation. Length of your CV is proportional to the length of your... You try and beat people and best people and get external validation. Look at me, look at me, look at me. And you know what? Imposter syndrome's a great thing because it gets you off your fat ass. The problem is when it becomes toxic. So I no longer have imposter syndrome, not because I shouldn't, but because I realize we're all equally flawed and capable, and your job is to work out what your USP is and bring it. But this was me. Now, it wasn't booze, pills, or sex, or anything like that. It was a general sense of, what is the point? What am I doing here? I suffered affluenza. Everything was going fine. I had ennui. I had the lack of a challenge, and I had my crash. And if you're lucky, you will have loved ones around you to give you that second mountain of significance and engagement and internal validation rather than external validation. But if you haven't done the work here to maintain those people, don't expect them to be there when you need them. The greatest thing I did in my 40s was re-engage with my mates, volunteer in my community, and stop starting every sentence with, well, as a doctor, I think you'll find. The point is, your career should be learning, earning, and returning. Now, that doesn't have to be in thirds, only in the first third. That should be in a week. That should be throughout. And if you're not returning, you're not paying back. And if you're not returning, you eventually are going to feel the vacuousness of it all. Happiness is an inside job, ladies and gentlemen, so we can't just blame admin, though they could maintain us as well as they maintain the machines, let's be honest. Burnout is a very opaque term, and it's difficult for all of us, but it sits at the nexus of everything that matters, just like culture. Before administration agreed that I should be fired as an administrator, it was mutual, eventually. I used to do my annual reports with people with my fingers underneath the desk, and I would basically go through this. Are they exhausted? Now, I don't mean physically exhausted, you've just come off the ski hill. I mean that, oh, what's the point? Depersonalized, are you going through the motions? Are you moving the meat? Dehumanized, is it bed 4 or is it Mr. Smith? Is it the appy or is it Mr. Smith? I force my trainees every Monday to go and find out something about the patient as a human being and bring it back, and we incorporate that daily. My notes are notes to the patient, not notes to us, the medical clique. Have you lost meaning, and do you have low resistance? Now let's talk about resistance quickly, because it's been mentioned many times today. It's a very practical thing. It's not a buzzword. And in fact, you don't so much increase your burnout as you drop your resilience, because we're always close to burnout. We're always at risk. The issue is you get sick, you don't get a promotion, you have a divorce, whatever it might be, and it's your burnout that flares because your resilience drops. Now, at the bottom of this slide is a thing called renewnow.org. It's fascinating. You go on there and it says, how many times did you laugh out loud in the last week? How many friends do you have when you screw up? It's very practical. Sleep. Folks, this is a better drug than Ozempic or Prozac. Exercise. I don't mean you're going to do a half marathon, full marathon, ultra marathon, and then tell the nurses about it every day on rounds. How do you know a doctor's run a marathon? Don't worry, they'll tell you. Have you had genuine fun? Do you get some quiet time to get away from it all? Poor old introverts get dragged into meetings every day. Poor old extroverts get silenced in meetings every day. And do you have a self-definition? Because one day you won't be a doctor, you won't be a nurse, you won't be a trauma person, you'll just be a schmo in the lineup to the coffee. Words matter. We underdiagnose the problems, and we're especially sexist and tell women they're a bit moody. And we're especially sexist on the other end, and when men are suicidal and depressed, we just say, they're just beaking off again. So the words matter, so let's be more precise. But our actions matter even more, because if we're not careful, we just create a burnout contagion where we take people and now we add on a new diagnosis and we say, you know what, you kind of failed at mindfulness as well. You're a lousy yoga performer in addition to everything else you're lousy at. In a world where work is a religion, burnout is our crisis of faith. I think that's the best definition I can give it. And if I give you a British example, the belief is from the Clergy Project that about 40% of religious pastors in the UK are actually latterly atheists. They've lost their religion. Now, they might still do the job almost like a social worker because they enjoy the rituals and they enjoy being part of people's lives. In other words, they've redefined meaning. But again, I think we can all identify with this, and we can do things for each other. We are not machines to fix, we are gardens to tend. Say it loud, say it proud. We think the patients are like the top of the slide, they're actually like the bottom of the slide. The biggest cause of death is frailty in our part of the world, not in a conflict zone, but in our part of the world. It's multiple little drops. And guys, can I just get this point across? Mortality is still 100%. Our goal is to help people die better, later, and with love. That's it. It isn't whiz-bangery. Now, the whiz-bangery is important, but this is more important because we're in the death and dying business. This is a beautiful paper from the Lancet where death and dying should be valuable, where the dying person is communicating to the living. Stop being scared of this. Now, we've got to negotiate so that we don't become nihilistic, and I'm sure you've talked to ICU doctors like me where you think, they have just lost the plot. But memento mori, that's on the slide deliberately. Even in days of Roman triumphs where people were receiving all the adulation of the city, a slave was made to whisper into the hero's ear, remember you are mortal. I think it's a thing we could learn from every now and then. Don't lose the immense value of this. And Matt Morgan said this better than I ever could. And with the risk of being cheeky, I've already said that communication is our most important procedure. We really need to line up what the patients want with what we're offering them. And I hope you get the dark humor in this one as well. 2 weeks in the intensive care unit can save you 1 hour of a difficult conversation. What are people after? You know what? Clean water, vaccination, and community. Best 3 drugs for longevity. This is a study from Frome in Somerset, where they stopped calling people patients, and they called them people. They stopped saying, you've got a disease, and they started saying, or dyspnea, and they started saying, you can't get out and do the things that make you who you are. And so what we're going to do is provide taxis so you can get to the community center. Yeah, we'll give you puffers as well, but we're actually going to focus on your values and your interests. And if you notice, most of our medical interactions are, patient is dyspneic, prescribed bronchodilators, I'm a hero, off you go. We've got to admit there's a problem. Now, this is Gallup polling across society, but medical stuff is not far off. About 70% of us are disengaged, 50% of us contribute nothing, and 15% of us work against the system. But not me, I'm a hero. Not all heroes wear capes, etc., etc., insert old one-liner. Well, you know what? I bet you've had times when you contribute nothing. I bet you've had times when you work against the system. This, in the Canadian system, is you overbill the system because you can get away with it. Contribute nothing. This is when you form a committee that essentially does nothing. I teach a lot of airway, and I couldn't work out for years why there was a difficult airway society, a society of difficult airway, an airway difficult society, a difficult intubation society. I really think a lot of it was us filling our rotas. Surgeons of friends of mine have pointed out they don't have a difficult appendicitis society. Now, maybe I'm being unfair, maybe I'm being provocative, but that's my job today. What about meetings? The meeting to have a meeting. I survived another meeting that should have been an email. Meetings have been shown time and time again to provide less than 5%. Now, what is a conference but a meeting? It is. And so why is this rather overweight, possibly sweaty, middle-aged Canadian jumping around? Because I'm trying to provide more than 5%, guys. And I think that should be our watchword when we go to work. I'm going to wave the flag. I'm going to give more than 5%. Even orthopedics can do this, folks. This is the WHAM principle, winning hearts and minds. I don't know if you can see it from the back, but orthopedics, I presume the jokes are the same here. Orthopedics, at least it's close to a hospital. The point is, if they can do this, we can do this. Now, if that's all you do, that's rotten tokenism. And this is rotten tokenism too. These are the sort of inspiring signs you see. So Edmonton, my home city, has 2 leadership institutions. And they raised the money in about 15 minutes because everyone wanted little Janie and little Johnny to be the leader. But, as I pointed out the other day, 85% of us are better thought of as followers. What a situation often needs is you and I to go down there and say, how can I help? Studies have shown that when a guy like me goes down and an emergency doctor's trying to put a tube in, we actually want them to fail because it's then way easier for us to nudge them out of the way, show no teamwork whatsoever, and then receive all the plaudits afterwards. Followership is hard. Many of you will have seen this, but just to be very quick, this is a man dancing on his own at a music festival outside. I realize this is deviant behavior, and I apologize for exposing you to this. Somebody comes and dances with him. Everybody says this is the best time ever. So if they won't let you be the leader, and it feels too subordinate to be the follower, be the first follower. I guarantee you every system succeeds or fails based on the presence or the absence of a first follower. Own that role. Learn lines like, how can I help? Hey, I could do this, you do that. I'm sitting on a chair, would that help? Am I expanding your cognitive bandwidth? Am I allowing you to cognitively reframe? I know all of those terms too, but I'm trying to put it in very human terms. Because you and I, whether we're aware of it or not, are playing this, the status game. Where do we sit on the hierarchy? And by the way, this is part of why we tolerate demagogues, because we sort of see high status and we aspire to it. And this is why we sometimes accept our lowly status. The point I want to get across, though, guys, is this book points out some really interesting things. Number one, The problem with gossiping is it is bullying somebody who's not even there to be bullied. It is that backroom hallway stuff. And we do it because we're playing a status game. The next one's the humble brag. I can't stand the humble brag. You know, the old sort of, I was up all night. I'm really exhausted. And it's simultaneously saying, I'm better than you, and I'm one of the guys too. It's a bit bloody malicious when you break it down, isn't it? Some of you will have seen this, but this is the idea of you give a team spaghetti noodles and marshmallows and ask them to build a tower. Structural engineers are terrific at this. Adults, doctors, nurses, you name it, awful at this. Why? Because we spend most of our time trying to work out who's going to be responsible when it falls down and who's going to take credit when it doesn't fall down. Kids are great. Yeah, that's a good idea. Yeah, I like that. Yes, and it's a great principle. Why? Because what we really care about is this, the SCARF model. Status, a sense of certainty, a sense of autonomy, relatedness to other people, and a sense that the world has some fairness in it. So what can we do starting immediately? We can show ourselves a bit of self-compassion, but we can also be and look for failure friends. If you leave here without a failure friend, you have left here without mission one. In other words, when you screw up, you will need people, but also those people will need to know your script. Do I leave you alone, or do I actually butt in and make a nuisance of myself? Do I take you for a drink, or is that just not your flavor and we stay away from that kind of stuff? Be one, find one. You're going to need them. I needed them. Change the emotional contagion. Next time you're afraid to share ideas, remember somebody once said in a meeting, let's make a film with a tornado full of sharks. Don't start every meeting with, we've tried that before, that's never going to work. At least give them 2 minutes of, I can really hear your passion here, we don't have time for it, but you and I are going to meet. Dial down the adrenaline. You don't have to go to every argument you're invited to. And this is a Canadian one, the man who planted trees. We overestimate what we can do in a decade, and we chronically underestimate what we can do in a decade. Finally, guys, serve one another, serve one another. This is a glorious example of 2 nursing aides in Lancashire in England whose geriatrics ward had a colossal use of neuroleptics and restraints. And so they started having tea parties. What could be more English than that? People engaged, the adrenaline dropped, there was more of a sense of community, and people wanted to work there. In other words, they created a totally different emotional contagion. And that's what we have to do. And for the older people in the audience thinking, I've seen it, I've done it, I'm in my ketamine years, you know, where there's pain, but I don't associate it with me. This is your job, guys. And this is not your job. We've got to dose this accordingly. Now, if you ever have me back, I'll pick up the discussion about how you understand digital literature and live in a digital world and communicate with patients and advise them about resources. But be very careful. This thing is hacking your emotions very deliberately and not your better angels. The point is, guys, we can be connected but disconnected. Do you remember when the phone was tied down? We weren't. And now that the phone's not tied down, we are. If you can't do this for me, if I'm a bit too much, do it for dear old mum. This week, 20 years ago, she passed. When I get back, we're having a family celebration. We're going to tell the old jokes, play the old music, and cook the old meals, because we miss her every day. And going back to Matt's point, I feel crushed to this day that I didn't tell her more when she was around. You can't stop the waves, folks, but you can absolutely learn to surf. Or moguls or skis. It's entirely up to you. You're a glorious bunch. Thank you for your time, and thank you for having me here.